I'm 7 years post-facelift. The physician left a tire around my neck and then liposuctioned it. What can be done? Price for revision. Can you make my neck look smooth again? Many thanks for any information.
Thank you for your question. You've submitted 3 photos of your neck area, and you state that it is now 7 years since a facelift. And you stated that your physician, quote, left a tire around your neck and then lipoed it. And you're asking about some type of procedure to make your neck look better. Well, I can certainly give you a little bit of my approach to assessing a patient like yourself who would come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and face and neck lifting surgery where we do everything from suture suspension, minimally invasive surgery, to short scar, to advanced deep plane facelifting is part of my practice, a significant part of what I do. So without seeing your pre-op photos and getting more detail about your post-operative progress after your surgery, I'm just going to give you a little bit of insight of how I make a decision about or a recommendation as to what is the best option. So to begin with, it is likely that you chose a doctor at the time who you felt was competent and capable to do your surgery. And the appearance that you have is a combination of some excess skin and what looks like some degree of scarring and what we call adherent skin. Now, when you describe what you call a tire, what comes to my mind is that after surgery you developed maybe a lot of swelling, a lot of fluid. And this is the kind of situation where that type of response is referred to as a seroma. And that requires a lot of very active management, such as tapping and removing fluid. And it's important to identify and describe very specifically your post-op experience from the previous surgery before you undergo your next surgery. You see, I'll explain this a little bit more. When we all do face and neck lifting surgery, and I think anyone who performs this operation has their own unique style of doing the procedure, but we all basically want to be comfortable and happy with the result on the table. Because the golden rule is if it doesn't look good on the table, it's not going to look good outside. So on the operating room table, it is likely that you did look good and everything probably was to satisfaction. Now, if that's not the case, or if you did not look good soon after the surgery, that's a different story. But it's not only how good you look immediately intraoperatively, but it's also there is a lot of that has to do with the postoperative care, and if there is any other complicating issues. And the most common things are hematoma, bleeding, and seroma, this kind of what's mixture of this inflammatory fluid that is from leaky vessels and lymphatics that occur from surgery. So it's no question that you were likely to benefit from revision neck lifting surgery. There are other technologies that we employ these days in my practice where we do things to help improve the skin quality before undergoing the surgery, because you simply don't want to have a repeat performance if your body has a tendency to form these types of seromas. There are certain questions I would ask. Was laser performed? Was this a laser-assisted procedure? What else? What were the circumstances? What other medical issues do you have at the time, and what are the active medical issues now? So I think technically there are a lot of different ways to approach your aesthetic appearance. But I think that if you don't provide really good detailed information about your experience postoperatively, you might be at risk of having some type of a repeated experience if there's a systemic issue or a local tissue response issue that is beyond just the technical aspects of surgical procedure. I think that one of the unfortunate realities right now is that there's so much interspecialty rivalry and people claim, believing that as individuals they're better surgeons than everybody else. That's a lot of surgeons' ego, but it's not. It's more than that. It's having technical expertise and experience is very important, but also understanding the canvas, the person who you're treating, and all of the variables, and managing those variables is critically important before you move forward. So meet with some cosmetic surgeons and learn about what the least invasive to the most aggressive options are. See what you're comfortable with. Understand what the risks will be. Understand what may be necessary in case you have a repeat performance. If, let's say, this was an example of seroma formation that wasn't managed as well as it could have been, how your doctor would approach that issue. Basically, ask more about the complications and also try to recall all the details of your previous experience. So I hope that was helpful. I wish you the best of luck, and thank you for your question.